Mariah, thank you so very much. Today, breast cancer is the most common form of cancer in women behind skin cancer. 1 in 8 women will be diagnosed, and it is not just will you know someone diagnosed, but when. Dr. Gregg Silverman joins us live to discuss this further. Dr. Silverman, always a pleasure. Thank you for being here. Breast Cancer Awareness Month. What do you think of first when it comes to this month, and what should people think about at home?
Well, I think that it's very important that people understand their risk, like you just said, of 1 in 8 women, and it's the second leading cause of cancer in women. And it's potentially preventable, and if not preventable, it is certainly findable at an earlier stage when it's significantly more treatable. So this is a really good idea. There's a lot of things out there. There are breast cancer awareness walks and money raisers and funding and those kind of things that get out there and get the idea out there that it is important for women to understand when to start having mammograms, when to start checking, and sort of the whole process of what a mammogram is, and what self-checking is, when and how often it's needed.
It seems more and more now we're hearing about younger women being diagnosed with this. Any thoughts as to what's going on here? Is it the way chemicals are being injected in foods? Is it just that there's more surveillance out there and we're identifying
I think we're just
sooner?
learning more, and I think that we're just doing a better job of actually looking and asking the questions, and that the younger women are understanding how important it is to check themselves, how important it is to talk to their physician or their family doctor or their healthcare provider, and I think healthcare providers are doing probably a better job of encouraging women to get checked.
With that said, I know a lot of women that will leave this area to go up north to Houston, they go to San Antonio to receive further care. Do you think that the Coastal Bend, there's enough resources here to treat and to care for and do what's needed?
I do. I do. I think from the surgeons who do the biopsies or the mastectomies to the chemotherapy and the cancer doctors who actually perform the chemotherapy, I think we do a very, very nice job of this. And I think that sometimes you get used to saying, well, I have to go to a bigger area. I don't think in chemotherapy and in cancer therapies you need to do that here. I think we have the right physicians down here. I think they're very well trained. And I think they do a very nice job.
What challenges do you think are up against women here in South Texas specifically? Do you see any one trend or trait that's kind of carrying along that, hey, we need to address this, we need to target this?
Yeah, I think of all the things that we look for, I think the idea of information is the most important part. I think that, understanding and saying to your physician and being able to talk to your physician is the most important thing here. I think sometimes women generally put things off and while they're working for every other part of their family or their lives and say, well, I can go deal with this problem and I'll deal with my problem later, or I can deal with that, or I can do that now and I'll deal with my problem later. And it's very important for women to understand that the earlier you catch this, the earlier you diagnose this, the earlier you start treating this, the better it is. And I think that women have to understand that your life is important as everything else, and to sit down and say, okay, it's okay for me to be treated. It's okay for me to go in. And it's okay for me to explain to my physician what problems or what questions I have. And find a physician that is willing and able to answer your questions.
And for the men in their lives to support them too and encourage that as well. Dr. Silverman, thank you so much for kicking off Breast Cancer Awareness Month, discussing this with us. We really appreciate your time. Thank you. If you have a question for Dr. Silverman, please send us a text at 361-855-6397.